Have you or someone in your family ever felt tired despite of sleeping all night? या फिर रात को जोर से स्नोर करना और सांस लेने में दिक्कत महसूस करना एक आम बात बन गई है? तो समझिए कि ये सिर्फ नॉर्मल स्लीप प्रॉब्लम नहीं बल्कि ऑब्स्ट्रक्टिव स्लीप एपनिया यानी OSA भी हो सकता है। ये एक ऐसी मेडिकल कंडीशन है जो आपके ओवरऑल हेल्थ पे काफी सीरियस इम्पैक्ट डाल सकती है। सो नमस्ते एंड वेलकम एवरीवन टू अनदर एपिसोड ऑफ बियॉन्ड द पिल वेयर हेल्थ मीट्स कन्वर्सेशन। आई एम योर होस्ट डॉक्टर चेतना और आज के एपिसोड में हम बात करेंगे ऑब्स्ट्रक्टिव स्लीप एपनिया के बारे में, एक ऐसी कंडीशन विच इज अ थ्रेट टू योर हेल्थ। टू मेक अस अंडरस्टैंड दिस better, joining us today is Dr. Arup Halder. He is a senior consultant pulmonologist in the Department of Pulmonary Medicine at CMRI Hospital, Kolkata. With over 15 years of experience in pulmonary medicine, he has his expertise in sleep medicine, especially in sleep disordered breathing. Doctor also has been engaged in polysomnography with over 13 years and has done many research studies in this area. So let's give him a warm welcome and understand what is OSA and how to treat it. So hello doctor, and thank you for coming in our show today, which is Beyond the Pill. So thanks a lot for joining us, and it's an honor to have you with us today. So how are you and how do you feel being on the show?
So I'm fine. Thank you for having me. So this is Bengali New Year and Shubho Noboborsho to
Today?
you. Not today, just
okay.
2 days past we have a Bengali New Year. So Shubho Noboborsho to you.
And to you also.
Thank you.
Okay. Let's first understand that what inspired you to become a doctor, especially when I was reading that you specialize in sleep medicine.
Right. So, inspiration-wise, just I cracked the exam and just got into the subject, and then I started loving the subject, and I passed my MBBS and I have done my post-graduation and got into this sleep business. So sleep medicine is a very neglected subject all over our country actually, because we do not have any particular discipline which is dedicated only to this entity of sleep medicine.
That is right.
So sometimes the pulmonologist practice sleep, sometimes the psychiatrist practice sleep, the neurologist also practice sleep. So this is a nobody's domain at present.
Okay.
But as we'll deal in our conversation, that we'll see there are a lot of patients having different kinds of sleep problems, and actually there should be a separate discipline of sleep medicine now, because the researches are going very rapidly in different fields of the sleep disorders, and itself it demands to be a separate subject now.
Okay, so like rightly you said that it has been neglected. And I feel that large population who doesn't actually know what exactly is sleep medicine and what are the problems जिसके वजह से this sleep medicine as a field is very important right now. So our today's topic is obstructive sleep apnea. So to understand that, let's just start with the people usually think that they're snoring at night, and I don't think that many of them realize that this snoring can also be a life-threatening medical condition.
Right. So snoring we used to take with the or the smell of laughter actually. If somebody is snoring, then probably sleeping very deeply. That was the previous understanding. But now we call snoring is an alarm bell of ill health. Okay. So why there is snoring? Snoring because there is some obstruction in the upper airway, so that there is a turbulent flow in the upper airway, there is a vibration of the lateral wall of the airways, and there is a production of the sound.
Okay.
So snoring means there is some obstruction. Now, we call snoring, we have a notion that snoring arises from nose. It is not like that it arises from the nose. It actually arises from the throat.
Okay.
Vibrations actually arises from the throat. So snoring is a sound, and sometimes during snoring there is a pause of breathing. There is no sound of snoring, and that is dangerous. Actually, that pause actually signifies the patient is having an apnea. So what is apnea? Apnea means complete stoppage of breathing. That means oxygen is not entering into the body. The carbon dioxide which is generated in the body is not being excreted into the atmosphere. So the oxygen level in the blood drops, the carbon dioxide level in the blood rises up, and you have a profound hypoxia. That means a low oxygen saturation during sleep. So your brain is not getting adequate oxygen, your heart is not getting adequate oxygen, all organs are getting deprived of oxygen. So this is a state which occurs repeatedly during sleep.
Okay.
Okay. So each episode lasts for about few seconds, and you're having several such episodes throughout the sleep. So your sleep gets fragmented because your brain wakes up with low oxygen saturations. And we call sleep is a rebooting of the body and mind.
Right.
So when we sleep, there are several stages. The body gets rebooted during the N1, N2, N3 part of the sleep. And in the REM sleep, the sleep where we dream actually, in that part, we have a rebooting of the mind. There is a consolidation of the memory. So if you do not have this rebooting of the mind and body, your aging becomes accelerated. You age too much rapidly, not yearly. You age 3 yearly in a year.
Okay.
So that is the problem with obstructive sleep apnea.
But I'll tell you that you being a medical professional, you being a doctor, you know that this is the significant difference between sleep apnea and snoring.
Right.
But I feel that normal population or common people cannot understand the difference कि exactly जो उनके साथ है, जो भी उनका पेशेंट या रिलेटिव है, वो स्नोर कर रहा है या उसको स्लीप एपनिया का प्रॉब्लम है. इवन द पेशेंट आई फील कैन नॉट मेक आउट कि प्रॉब्लम एग्जैक्टली किस चीज की है. So how do they realize कि they are suffering, like the patient is suffering from sleep apnea and it's not normal snoring?
Right. So all snoring is not sleep apnea.
Okay.
Okay. But definitely snoring is an important sign of sleep apnea. Okay. So if you have, during snoring, if you have a pause in the breathing or choking episodes during snoring, and if you have a daytime sleepiness, if you have dry mouth during sleep, then that signifies patient may have an obstructive sleep apnea. So obstructive sleep apnea is a syndrome which, along with snoring, have witness pause of breathing, choking episodes during sleep, and the consequence of this poor sleep is the daytime sleepiness the next day.
So these are like the classic symptoms of sleep apnea.
Right.
Now also there's one more question that arises in my mind, that if someone is having this and even if they come to know that this is not something normal, so when do they realize that now is the time to go to doctor, and especially which doctor? Because people visit ENT for this. I mean, why do a person needs to come a pulmonologist for this?
Right. So if the patient is snoring, along with the bed partner telling that he is having choking episodes during sleep and he is having a daytime sleepiness or a fatigue during the daytime, if he is having a mood problem, so sleep deprivation causes anxiety and depression. If he is having a problem with the memory, then that suggests he is having obstructive sleep apnea.
Okay. They
should visit a doctor. It may be a medicine doctor, it may be a pulmonologist, it may be an ENT, it may be a psychiatrist. So, as I have told, sleep medicine now in nobody's field, everybody practice sleep medicine. So, he should go to a doctor who actually practices sleep.
Okay.
Because they should be conversant with the different kind of sleep disorders. What are the different investigations done in sleep disorder? It is not that he has to go to a pulmonologist, but a lot of pulmonologists are now doing sleep practice. So definitely they can go to a pulmonologist or an ENT surgeon, and actually they should be tested for their symptoms.
Understood. So how much is it prevalent in India? Like how many patients do you see with sleep apnea regularly?
So sleep apnea is widely prevalent in our country. So in a recent study which has been done in AIIMS, they have done a meta-analysis of different studies. They have told that 15% of our male population is having obstructive sleep apnea.
Okay.
So it's a huge number in crores.
Okay.
And 5 to 8% of the female population is having obstructive sleep apnea. So the numbers are huge. And if you take this just simple snoring, it may be half of the population may be snoring during the night, but all not having sleep apnea. But
right.
Sleep apnea is a huge number. almost 10 to 15% of the population is having obstructive sleep apnea syndrome. But most of the people do not know that they have obstructive
That
sleep
is the
apnea.
main problem.
One of the main problem in treating obstructive sleep apnea is that the patient is sleeping. Actually, he is not feeling any symptoms.
Yeah.
It is the bed partner who takes us the patient to a doctor.
That's why it's important कि वो जो bed partner है उसको awareness हो कि ये snoring normal नहीं है.
Right.
This is something which needs to be checked by a doctor.
Right.
And so obstructive sleep apnea, as the name suggests, so does the patient feel breathing difficulty while sleeping?
Not always. Not always. So obstructive sleep apnea is a part of a sleep related breathing disorder we call SDB in short form, which has other forms of sleep disorder also, like central sleep apnea. Okay. So in central sleep apnea, patient often feel breathless during sleep.
Okay.
But in obstructive sleep apnea, usually they did not complain about this breathlessness during sleep. But they have a very restless sleep.
Is it prevalent in kids as well?
Yes, it can occur at any age.
Any age. Okay.
It is not like that. It is not doesn't occur in younger age groups. Younger age groups are also vulnerable to having obstructive sleep apnea, and one of the main cause in them is adenotonsillar hypertrophy. If there are adenoids and tonsil that is present in throat, if they gets enlarged, then they have this kind of issues, and this is very important for them because, as I have told, there is rebooting of the body and mind during sleep. If they have sleep apnea, their neurological development, their cognitive development since the childhood gets hampered. So this is very important for them. They become obese. Okay. They develop various kind of metabolic problems, the cardiovascular problems very early in their life.
So symptoms, does the symptom vary from that of adult sleep apnea?
Very good question, because adult patients with obstructive sleep apnea presents with snoring and daytime sleepiness.
Okay.
But children usually present with snoring and daytime hyperactivity.
Okay. That's opposite.
Because they want to actually hide their sleepiness with their hyperactivity.
Okay.
So if you ever encounter a child with attention deficit hyperactivity disorder, this child have obstructive sleep apnea probably. He is not sleeping well. That's why he is very much hyperactive. If his concentration is not good, he is not being good in classes, it is not he's not doing good results. So these all started from a sleep problem actually, and which is correctable with simple therapeutic.
So this looks like a very simple issue, no? Matlab, even the parents will not realize that there is something going on like this. So I feel that becomes difficult for the kid also to manage. And like earlier you mentioned that sleep apnea has a lot of impact on mental health of the patient as well. So I have seen that people with sleep apnea avoid going to social gatherings because they feel very embarrassed sleeping with other people, sharing the bed with other people, because usually the relatives get disturbed because of it. So how much does untreated sleep apnea has effect on physical and mental part of the patient, mental health of the patient?
So definitely, physically and mentally, the patient become weak if he has an obstructive sleep apnea. Physically, he can have various disorders. The main risk factors for untreated obstructive sleep apnea is cardiovascular outcomes. He may have a stroke. He may have not stroke. He may have a heart attack. He may have atrial fibrillation. He may have hypertension. Okay. From neurological point of view, he may have a stroke. Okay. From metabolic point of view, he may have a diabetes or metabolic syndrome or obesity. Okay. So all organs are affected actually. Mental health wise, he may have a depression. He may have anxiety. He may have a memory problem. He may have cognitive problem. He may have in the later life have Parkinsonism, Alzheimer's. All these things are related to obstructive sleep apnea.
So coming to the diagnosis part of it, how can a family member or even the patient know what exactly needs to be done and how to confirm that the person is having sleep apnea?
Right. So if the person is having sleep apnea, that means if he's having snoring, daytime sleepiness, fatigue during the day, he should consult a doctor. Then the doctor examines the patient. asks a few questions, and along with he checks the upper airway. He checks the narrowing, whether the narrowing of the upper airway, there is narrowing of the upper airway or not. And after that, he prescribes a study which is called a sleep study or polysomnography.
Okay.
So there are several types of sleep study depending on the level of the problem or the complexity of the problem. He usually may undergo a level 1 sleep study, which is the broad one, which is the gold standard, or he may go a level 3 sleep study, which can be done at home. So it depends on the severity of the problem or the complexity of the problem, which determines which type of sleep study he should undergo.
Okay. So ये जो sleep study है, I mean people doesn't even know कि ये कहाँ जाके होती है. They know कि X-ray, blood test वगैरह एक path lab में जाके होता है. But where can someone go to do this sleep study?
So sleep study, as I've told, can be done in the sleep lab. The sleep lab may be situated in a hospital, or it may be a standalone sleep lab in like any pathological center, or it may be done at home. So that depends on the level of sleep study. If the subject is prescribed a level 1 sleep study, then he has to go to a sleep lab. So either in the hospital or a standalone sleep lab, or for other studies that can be done at home itself.
At home itself.
Yes.
Okay. So the patient is quite consciously sleeping that time. Is it that way? Like, I mean, or do you need some other interventions? Like you just ask the patient to sleep?
Yes. We just ask the patient to sleep, and during sleep, we measure several parameters. We measure the neurochannels. That means we measure the brain waves. That is called in our language EEG, electroencephalogram. We measure the eye movement. That is called electrooculogram. We measure the muscle tone. That is called electromyogram. We measure the airflow through the nose and the mouth by various nasal cannula and thermistor to see whether there is a stoppage of breathing or what is the flow of air he is getting during sleep. We measure thoracic and abdominal movement, that is movement of the chest and abdomen during sleep. So in obstructive sleep apnea, you have a vigorous movement of the thorax and abdomen during sleep. In central sleep apnea, you do not have any movement of the sleep. Then we also measure the ECG of the patient, electrocardiogram. We measure or sometimes we measure the blood pressure also. Okay. And we measure the oxygen saturation of the patient. So these all things are done during the night. And there are several studies that are going on simultaneously throughout the night. So patients first have to be hooked up with different this kind of devices.
Is it like invasive?
No, it is not. It is not non-invasive test. This is just like ECG, just putting some leads on the heads and the chest.
So how can the person sleep comfortably?
Patients usually sleep very well with all this kind of device. And our experience is that when we are putting the EEG leads actually in the head, so the movement, the subtle movement actually, the patient sleeps during the hooking up itself. And usually they are more sleepy actually. So they can sleep anywhere. So if someone boasts that I can sleep anywhere and everywhere, so it is not that he's not having any sleep problem. He's definitely having sleep problem. That's why he can sleep anywhere and everywhere.
So we do this frequent travel in trains and flights and even in car. So I have seen people really just sleeping and snoring the loudest at that time. And if we tell them कि भाई कुछ problem हो रहा है, they take it very offensively. No one takes it like, okay, I have a problem, I should go to a doctor. They'll be like, नहीं ठीक है. मतलब they're in denial. They don't even accept that कुछ issue है मेरे में.
Right. Yes, definitely. Because the patient is sleeping, he is not perceiving the symptoms. Only the fellow persons beside him, they can. So whenever such patients comes to us, done a sleep study, and we demonstrate them how much oxygen dipped during sleep. Because we have seen patients, oxygen level coming up to 30% during sleep.
Oh God.
So you cannot imagine, when he's sitting in my outdoor, his oxygen saturation is 96, going to bed, oxygen saturation dipping to 30%. So he can have a sudden death during sleep. So if your oxygen saturation dips less than 75% during sleep, the person is at risk of sudden cardiac death during sleep.
That's why it's life-threatening,
Okay,
right?
and we see many of such patients.
Okay.
And they're undergoing this cycle repeatedly every night. So during sleep, they're getting at the danger zone, and we don't know. So you have seen that many patients have just died during sleep. So this is one of the greatest cause of sudden cardiac death.
I'm getting scared that we take these Olas and Ubers and cab. What if the driver has a sleep apnea?
So this is not only sleep apnea. What happens in this app cab driving, they're sleep deprived actually. They do duties for 24 hours, 48 hours at a stretch. And this drowsy driving is more dangerous than alcohol or alcohol-driven drowsy.
I agree. Yeah.
So there are many accidents. Okay, so sleep hygiene is something we usually try to ignore, or we think that sleep is just a waste of time. Just you can curtle it, you can see mobile, you can watch a television. So sleep is not required for us, just a waste of time. So, but this is we call it ignorance, health ignorance. So sleep is important for your daily living, your cognitive ability, your concentration, your memory. So do not actually curtail down on your sleep.
That's right.
You have to take your full quota of sleep every night.
That's true. So what about chain smokers and alcoholics? I mean, do they also can have this possibility of getting sleep apnea?
So it comes with the lifestyle actually. So chain smokers, if you ask me what is the relationship between smoking and obstructive sleep apnea, is there any relationship? Yes, definitely there is relationship, because smoking causes a lot of changes in the upper airway also. The upper airway gets thickened. They may have obstructive sleep apnea, and various studies have shown the smokers also have increased propensity to develop obstructive sleep apnea.
Alcoholics?
Alcoholic, definitely they have.
They have.
Because what happens in alcoholics, after taking consumption of alcohol, there is a muscle relaxation. So if your muscle relaxes too much, then what happens? Your upper airway dilator muscles, which keeps your upper airway open during sleep, they also relaxes.
Understood.
Okay. So it cannot keep the upper airway open during sleep. They collapses, and the patient may have obstructive sleep apnea.
So someone who quits smoking or alcohol, can it lead to relaxation of sleep apnea issue?
Definitely they should do it, but this is not the single factors which will actually cure obstructive sleep apnea. They have to be treated for obstructive sleep apnea itself. So this, if the obstructive sleep apnea is a disorder which is a chronic inflammatory disorder. Smoking causes a chronic inflammatory disorder. Alcohol is also a causative factor of a chronic inflammatory disorder. So if they mingle together, they are like small waves in a pond. If they mingle in a pond together, that will create a different kind of waves, different kind of inflammation. So they all should be actually stopped, and the lifestyle should be changed.
So is sleep apnea only a lifestyle disorder, or even genes, like genetically it can be seen in the family?
That's a very good question again. Definitely genetic factors play a role. For all diseases, chronic diseases now, we have a genetic background. On that, there are environmental exposures on a time platform. So this is called getomic platform in COPD, but this platform can be applied for most of the diseases. So you have a genetic predisposition and on that individual you have the lifestyle factor, environmental exposures over time period. So definitely often obstructive sleep apnea runs in families, because in certain families you have a particular type of a facial structure. Their mandible may be retracted backwards. That is, we call retrognathia.
Okay.
If you have a retrognathia or receding chin, that causes actually your upper airway to become narrow, and that can run in families. So they are predisposed to obstructive sleep apnea since childhood, but they do not probably develop in childhood because they have a good muscle power. But when they go into adulthood, the muscle power actually relaxes, their ventilatory instability comes into play, and they now develop obstructive sleep apnea. So that's why they run in family, and definitely lifestyle has a major role to play, because if the patient becomes obese, he have a high chance of having obstructive sleep apnea. So obesity is one of the risk factor for obstructive sleep apnea. So alcohol, smoking, all this, poor sleep itself can invite obesity and can cause obstructive
if
sleep
someone
apnea.
knows that I have a possibility of developing sleep apnea, what can be the preventive measures that can be taken from early on?
So that's a good question again. So prevention is always better than cure. So if somebody has a propensity to develop obstructive sleep apnea, he should maintain his weight very meticulously. He should regularly exercise to maintain the muscle tone. He should follow the sleep hygiene very strictly, regular hours of sleep, no addiction, and he should be very meticulous about the diets also. So these are the things they can do.
So any specific diet which can help to reduce or OSA?
Not as such. So if you want to restrict your weight to a certain value, you have to follow a low carb diet. That is mandatory for us, because what happens in Indian male, we have seen they have a very high propensity to develop abdominal obesity.
Yes.
Okay, so their fat tissue gets accumulated mainly in the abdomen and in the neck. So if you have a fat in the abdomen, it causes a poor movement of the diaphragm. And if you have a fat in the neck, that causes constriction of the upper airway. So they are very prone to develop obstructive sleep apnea. So their BMI may be normal, even though they have more fats in the belly and the neck, and they develop obstructive sleep apnea. So this is a very common in Indian male. So these things they have to follow.
So this was like the non-medical treatment part of sleep apnea. But when we come to the medical management of it, so what are the recent advancement or what are the treatment options that are available for treating sleep apnea?
So whenever we diagnose a patient of obstructive sleep apnea, we first grade the severity of obstructive sleep apnea, and that is done by doing one index which we call apnea hypopnea index, or in short form this is called AHI. If the AHI is less than 5, so this patient has no obstructive sleep apnea. AHI between 5 to 14, patient have mild obstructive sleep apnea. 15 to 30, moderate obstructive sleep apnea, and more than 30, severe obstructive sleep apnea. So all moderate and severe obstructive sleep apnea should be treated. And now the guideline tells if the patient, along with the sleep apnea with AHI of more than 5, if they have a daytime sleepiness, fatigue, poor sleep-related quality of life, even they should be treated. Or if they have hypertension, they should be treated. So the first treatment definitely becomes a CPAP, or continuous positive airway pressure, or automatic positive airway pressure, we call APAP. So CPAP or the positive airway pressure is the main treatment, but apart from that, we definitely ask the patient to follow some other lifestyle interventions like losing weight. We also ask the patient to do myofunctional therapy. So myofunctional therapy, we call it a face gym.
Gym?
Yeah. So these are upper airway muscle exercises. Okay. So we go to gym to develop our limb muscles, but we not concentrate on our face muscles. So these are the muscles which actually make the upper airway dilator muscle stronger. So these are called myofunctional therapy. Few exercises, lots of videos are there in the YouTube. So we ask them to follow these exercises meticulously, because studies have shown that if you do myofunctional therapy regularly, that can actually reduce your obstructive sleep apnea by 50%.
Wow.
So that's a great number. Yeah. So myofunctional therapy, weight loss, daily walking, and if some patients have allergic rhinitis also. Allergic rhinitis causes a dynamic obstruction of the nose during sleep. And if you have a nose obstruction, our airway being, we call it Starling register, there is a possibility of obstruction in the upper airway. So if you just open the nose sometimes, your snoring may reduce. Actually, it may not be abolished, but it may be reduced. So often, if there is signs and symptoms of allergic rhinitis, we often prescribe a nasal, intranasal corticosteroids. And apart from that, we prescribe a CPAP to these patients.
So doctors keep suggesting that use CPAP, but what exactly is the CPAP machine?
So CPAP is continuous positive airway pressure machine. So it blows air to produce a pressure in the upper airway. So what happens in obstructive sleep apnea? The upper airway is getting closed. So now we are giving pressure through a machine which keeps your upper airway open during sleep so that airflow or the entry of oxygen or the exit of the carbon dioxide becomes smooth and you do not have any obstruction of the snoring during sleep. So it just produces a pressure. It is not a device which gives oxygen. So many persons have told us, is it giving it us oxygen? So no, this
like
is not
BiPAP.
giving it. Yeah. Not even the BiPAP. BiPAP gives two pressures.
Yes.
In CPAP, you have a single pressure which is delivered throughout the night. Suppose you have seen the patient's, this flow limitation we call gets abolished at 10 centimeter of water pressure. So you give this 10 centimeter of water pressure in the machine and patient gets it throughout the night. This is CPAP. In AutoPAP or APAP, the pressure actually varies according to the patient's demand. If the airflow obstruction is high, the machine increases its pressure. If it is low, the machine decreases the pressure. In BiPAP or BPAP, actually you have two pressures. One is the inspiratory positive airway pressure and one is expiratory positive airway pressure. In inspiratory positive airway pressure, during inspiration, the pressure increases, but during expiration, the pressure decreases. So it becomes a little easier for the patient to breathe against the machine. So if the patients require a very high pressure in CPAP, usually we shift them to BPAP actually. Okay. So these are the various kinds. We have APAP, BPAP and CPAP for obstructive sleep apnea.
So I'm trying to understand, but this looks like a very complex mechanism or the complex machine. So how comfortable are patients using this?
So that initial acceptance is real problem for a CPAP. So our teacher is to tell us a CPAP is a very big pill to swallow, but they have to swallow that every night. So that requires a lot of counseling in the initial part. But our experience is that those patients having very high severity of obstructive sleep apnea along with a severe daytime sleepiness, they accept CPAP instantly.
Because they need some relief.
So after the first 2 nights of use, they tell us that our life has changed. I am now waking up throughout the day. I can do a lot of work which we couldn't do because of the fatigue. So this happens to most of the patients, but there are again many patients who tell that they feel claustrophobic with the machine. They do not want to put a machine during sleep every night. And even if they put for few of the months, then later they become non-compliant. So compliance or adherence is a big issue with the CPAP. And we need a lot of counseling for these patients.
So there is no medicine to treat this?
So still now, the gold standard is definitely a positive airway pressure therapy. But now there is a lot of researches are going on different endotypes of obstructive sleep apnea. So endotype means what are the various pathological pathways that lead to obstructive sleep apnea. 4 endotypes have been described for obstructive sleep apnea. One endotype is anatomical obstruction, which is a prerequisite to develop obstructive sleep apnea. So for anatomical obstruction, either you need a CPAP or you need a surgery.
Okay.
Then we have low arousal threshold. If somebody wakes up very early or with trivial stimuli, so that causes an unstable sleep. So unstable sleep means unstable ventilatory system. Okay. So unstable sleep or low arousal threshold can cause obstructive sleep apnea. For that, we now prescribe few of the sedatives or hypnotics, not sedative, hypnotics. Then patient may have a loop gain. Loop gain is an engineering term. The loop gains actually signifies ventilatory instability. For that, we have few drugs which is coming into the market. And last but not the least, for those patients who have a muscle responsiveness problem, their muscles become much more floppy during sleep. For them, few of the drugs are coming. They have shown very good results in the phase 3 studies. And the anti-obesity drugs which are coming into the market, like tirzepatide, which is talk of the town now. So they can reduce weight to a significant amount, and they can reduce also sleep apnea. And this drug has been approved as one of the drug of obstructive sleep apnea for those patients who are actually obese. So many of the drugs are coming in the market, but still now positive airway pressure therapy is the gold standard of treating obstructive sleep apnea.
So surgery can permanently treat sleep apnea?
Yes, surgery is another option to treat the anatomical obstruction, but you have to remember the surgery is not a single level surgery. So we also send the patient to surgeon, ENT surgeon, for various kinds of treatment. But before that, they have to undergo a procedure that is called drug-induced sleep endoscopy. We call it DISE. So in DISE, they see what are the levels of obstruction there. So usually it's a multi-level surgery which is required. This is very complex, and these surgeries are also very new. The surgeons are also in the learning curve. But there are few very good surgeons in India who are doing fantastic jobs. They're curing hundreds of patients. But selection of patient is very important for them. So this is one of the important factor. All patients are not candidate for surgery.
Okay.
There are few patients. And also we have now hypoglossal nerve pacemaker for sleep apnea. Yes. So that is a form of therapy, which is we put a pacemaker, and that actually stimulates the hypoglossal nerve
like
during sleep.
Okay.
And that actually opens the airway. So this is now being done in Singapore, USA, but still not available in our country. But I think in next 1 year, it will be available in our
like
country.
A recent advance.
Very recent advance.
Okay. So can sleep apnea be completely cured?
Like most of the other chronic diseases, it cannot be cured, but it can be controlled.
And if someone who's going undergoing surgery, can after that this sleep apnea can reoccur?
Yes. So surgery can actually cure obstructive sleep apnea in many of the patients. They have a different definition of cure than what we actually apply as a cure. But if the patient gains weight, if the abnormal physiology again returns, patient may again develop the same kind of problem. So through surgery, you are actually correcting the anatomical abnormality. So beyond anatomy, if there is some physiological abnormality, if they recurs again, patient may have the same problem.
Because I know someone who underwent rhinoplasty, but then again he started getting the symptoms. So he thought that the surgery was not good.
So so I think you are talking about septoplasty. Septoplasty is an operation which is done for the deviated nasal septum. So many has a idea that if you do a septoplasty, your snoring will cure. So septoplasty is not an operation to cure snoring. Okay. So septoplasty is indicated in obstructive sleep apnea, where the patient actually cannot take CPAP because of the deviated nasal septum. Then they have to cure their nose. They have to do a septoplasty to become adherent to obstructive sleep apnea, adherent to the CPAP. So this is not a operation which can cure obstructive sleep apnea.
So just one last question. What are the common misconception or myths that you come across in the patients who have sleep apnea?
So there are many such. So one thing that snoring means you are sleeping very deeply. It's not like that. Snoring means an alarm bell of ill health. There is an obstruction that has to be either cured or taken care of. Second is that I can sleep anywhere and everywhere.
It's not a good
So I do not have a sleep problem. So if you can sleep anywhere and everywhere, you definitely have a sleep problem. Third is that you have a different, your CPAP is the only treatment of sleep apnea. Yes, definitely CPAP is the only treatment of sleep apnea. But apart from that, you have lifestyle changes, you have myofunctional therapy, your allergic rhinitis should be taken care of. Fourth, children do not have obstructive sleep apnea. Yes, children do have obstructive sleep apnea. Another is obstructive sleep apnea occurs only in obese patient. In India, we have seen obesity is definitely a risk factor, but even non-obese patient may have obstructive sleep apnea, and significant number are suffering from obstructive sleep apnea. Last, if you do not treat obstructive sleep apnea, you will just have sleep problems, nothing will occur. Obstructive sleep apnea causes problem in every organs of the body. So if you are not treating obstructive sleep apnea, your heart may fail, your brain may fail.
So thank you so much for this important message. We have a small segment which is myths versus fact, and let me just tell you that there are some questions. You have to very quickly give answers for them. All right.
Right.
So let's get started. First one is snoring always means you have OSA or obstructive sleep apnea.
It's a myth actually. Snoring doesn't mean that you have obstructive sleep apnea, but snoring is one of the important symptom of obstructive sleep apnea.
So OSA can increase your risk of heart disease and stroke.
This is true.
Only overweight or obese people are at risk of developing orthopedic OSA.
So this is false actually. This is a myth. So even non-obese person can have obstructive sleep apnea.
Children cannot develop OSA.
So this is again a false statement. Children do have obstructive sleep apnea.
Using a CPAP machine is one of the most effective treatment of OSA.
It's true. The CPAP is still the gold standard of treating obstructive sleep apnea.
OSA doesn't require treatment unless it causes severe symptoms.
OSA needs treatment if there is excessive daytime sleepiness, if there is hypertension, if there is decreased sleep-related quality of life. So this is statement is partially correct. You can tell.
Okay. Lifestyle changes like weight loss and avoiding alcohol before bed can improve OSA symptoms.
Yes, definitely.
Okay. OSA can go away on its own without any intervention.
No, OSA will not go on its own without an intervention. Either you have to lose your weight, or you have to treat your obstructive sleep apnea.
Thank you so much for coming on the show and giving us clarity about OSA today. Thanks a lot.
Thank you. Thank you for having me. I think this kind of discussions will actually increase the awareness on OSA, and we'll try to, and we are actually trying a lot to increase the awareness of OSA across various forums. Yes. And this kind of discussion will help all of us to mitigate this kind of diseases.
I'm sure. So lastly, one important advice that you would like to give to our viewers so that we can also help and increase awareness about OSA.
Right. So obstructive sleep apnea is a very neglected disease in our country. So if somebody is snoring and having daytime sleepiness and fatigue and mood problem, they should actually consult a doctor, because this disease can be controlled with the treatment available in our country, and this will actually prevent many of the future diseases in that patient. Okay, so you just visit a doctor if your spouse is snoring and having all the symptoms I have described.
Thank you.
Thank you. Thanks a lot.
तो आज के एपिसोड से हमने ये जाना कि OSA सिर्फ एक नॉर्मल स्लीप डिसऑर्डर नहीं, बल्कि एक ऐसी कंडीशन है जिसको टाइम पे डायग्नोसिस और ट्रीटमेंट करना बहुत जरूरी है. सो इफ यू फाइंड आवर वीडियोस इन्फॉर्मेटिव, डोंट फॉरगेट टू सब्सक्राइब टू आवर चैनल एंड फॉलो अस ऑन Instagram at Mankind Specialities for more such valuable health discussion on various health topics. Until then, stay informed, stay healthy.